The next thing is I'm going to hand over. You've had enough of me for the last 2 days. Honestly, I've been speaking too much and you're bored. So I'm going to hand over to experts in the field. So Philippe Garouel is a good friend who's come all the way from France. He'll be chairing a session, a little discussion, and feel free to get involved and think about what questions you'd like to ask our expert panel. We've got Rajesh, you met before, a senior transplant surgeon at the Royal London. Also amazing in terms of what he does. He's just come from all parliamentary group yesterday, setting the agenda for digital health innovation and technology. So he's very much at the forefront in the UK of technology innovation, clinical trials, and bringing new ideas into the market. And he's done amazing things with that whole kind of journey. And Dylan's like Mr. Malta, I call him now. You are Mr. Malta. Dylan Attard is a surgeon, but he's kind of maneuvered himself out of surgery. He might come back one day, I'm not so sure. The longer it goes on for, less likely to come back. I lost to surgery, but again, to the world of digital innovation. He runs a brilliant conference in Malta called MedTech World, pushed out by Sigma, a big company in Malta. But he's trying to bring ecosystem in Malta of innovation, digital health, bringing VCs, startups together. And if you get a chance, you must go to his conference, which is going to be next year. It was only this year, of course. And who doesn't want to go to beautiful Malta for a conference rather than dreary London in December? I mean, I know the choice I'd make, despite founding Giant Health event. So I'm going to hand over to these guys and then talk about innovation healthcare and also their kind of passion. So, Philippe, it's all yours.
So, Dylan, what do you think? We should just stop, Just stop and register for Malta, I think that's...
Take one chair up.
So thank you everybody for still being here, So I think the main objective is for us, kind of wrap up, what we learned from the conference and all that. I'm sorry for you, Dylan. Dylan posted 2 days ago, that he's going to speak at the event with 2 legends, Rajesh and Shafi. Now I'm talking with 2 legends, with Rajesh and Dylan. So I think it's still a nice move. You move now to become a legend. So I think let's start, with kind of recap. So what are the key learnings, the key message that you find now out of this event? So let's start with the first legend.
Firstly, Shafi, just tell. He's got sesh. He looks good, isn't it?
So I mentioned earlier that someone from France bought me this Shesh, C-H-E-C-H-E. Apparently it's a beautiful thing. It's really soft and beautiful. And actually you can wear it in the autumn and spring, because just with the shirt, that's what French do. Raj just kindly gave me this, so I'm kind of wearing the beautiful Shesh. So thank you, Raj. No. Never heard of it before. Thank you.
No.
And don't bring it to Malta.
I know. No, I think, firstly, thank you very much for all of you for staying, because that's the most important thing. And from my perspective in the last 2 days, the key themes I observed was that, firstly, the market is matured. We don't have any products which are on the bench, for example, at least people I've spoken to. A lot of them are at least in the developed stage or at the validation stage, which is a quite interesting shift from what we saw in this conference at least 2-3 years ago. I mean, I wouldn't say 100% of it. Certainly there seems to be more products on that range rather than the beginning of the range. And with regards to the themes of it, it's really looking at more engagement. That's the thing I saw with a lot of the tools. And also products which comes with ways of how we can adopt them. Some of them have got published papers, which is quite good to see, the people I spoke to, which just means that for clinicians like me and others, we can go back and really look at how we can consider that in our practice. And that was the other theme I saw in the areas or the teams I spoke to. And of course, the one thing coming up with the conversation is that how AI or this kind of digital health is going to influence what we're going to do. That's a wider sense of conversation I had with people. So that's why I used the word matured in the context of how it was before in the last 2-3 years, is that we are at a point where there are a bit more choices with regards to things we can take it to real world, for the work. I think that's where I think we are. And that's a sense I got in the last 2 days.
Okay, Dylan?
I think when it comes to Giant Health, the coziness of the event goes on to show that even though especially when it comes to the whole NHS, the negative possible PR and aura surrounding it. I mean, when it comes to the people who make up the NHS, they're full of ideas, they're full of determination to come up with different startups, even when it comes to the student community. I mean, I've seen quite a huge community of medical students here looking to learn from the current startups that there are, possibly come up with startups of their own in the future. So that goes on to show that at least there's a nice future ahead, irrelevant of what policymakers or different governments come up with good or bad ideas. When it comes to the actual medtech and health tech industry in general, something that I'm quite keen on seeing more is that more companies are realizing more in terms how much they should care for the environment, be it whatever technology ways they're up to, but more companies are becoming more aware about the ESG goals that they need to cater to account for. So it's no longer like different industries, for example, the tourism industry, which has been like in the past couple of years always been one of the main industries discussed about how they're affecting our environment negatively. But now we're realizing that even when it comes to technology companies and the digital health and medtech companies that we're coming up with can actually help to solve the environmental crisis, which eventually might become the next pandemic down the line.
Yeah, thank you very much. That's an important point because as I say, you see it now more and more in different conferences. There's a topic and you cannot say not me, not me. You know, it's the other industry, it's the supply chain, it's the transport. I think we have all something to do in that space, and I think it was one of the key stream yesterday in that exact same room. So I think we cannot hide us and saying it's not us. We have to all participate in that. And that's maybe coming to another point we discussed earlier, Rajesh. I think the point is about why we come to these different events and what is the difference between, you know, why we should go to Giant Health and not to another one, not to Giant Health. So what is for you, from your point of view, the key differentiator and what makes you select one event rather than another?
That's a very interesting question, simply because there are a lot of events like this. So which means really, as somebody who's not familiar, when you start off attending these events, how do you choose? And also, what kind of message you take so that you can have something to relate to your extended teams? Like medics or clinicians in this room, when you do a medical conference, we go back and we give an update to our team about the number of papers presented, the topical things and everything. We don't do that for our teams. But what I find is that things like Giant Health and MedTech World, they have that balance where there's enough information for the clinical teams to go and listen to, and more importantly, understand, because I'm not an expert in AI. And secondly, also balance the program in such a way that there is sort of ability to interact. And the practical thing, what I saw was that since I started coming to these kind of events, now my nursing staff, they were here in the morning. These are dialysis nurses who took annual leave to come to a MedTech event. What that really shows is the interest of not just doctors learning these things and trying to implement it, the nursing teams, and these are the nurses who talk to patients every other day. The patient comes for dialysis 3 times a week. So that means really, for me, the events like this, that's the first thing I look for, how the program is laid out, how easier it is, the information is made easy for people who are attending with lack of a sort of wider experience. Second thing is, of course, the comfort. You know, the whole thing is laid out nicely. It's very welcoming, and more importantly, it's made free for healthcare staff. That's a big thing. So therefore, I think that's a stream I noticed in every event I went to, the recognition that making it easy for people to come in when we have limited funding for these things. That's the second thing. Third thing is really that, like what I touched upon the previous point, it is the products which are ready enough so we can get excited with one of them at least to go back and talk. Whether it's one of the trials we finished was a hardware device. I met the team here. That was 2-3 years ago. Now we finished the trial with the team. Now we helped them to launch in India. So that's a perfect example of having products which can be taken to real world and we can be part of that journey. So those are the 3 things helps me to decide which one I would go for.
So thank you, Rajesh, and I think it's very valid point. So let's slightly change the question for you, Dylan, because Okay, we are Giant Health, we could ask Barry, but you are MedTech World. So maybe showing the other side of those events, what are your challenges and how you differentiate yourself, when you prepare such an event, because again, it's not something you do in 2 weeks. So there's a lot of preparation. I think it's even becoming more challenging today because some stuff come very quickly. Take the example of ChatGPT. ChatGPT, I think it's changing a lot about AI, but it came quickly. So if you do your program 6 months in advance, you might have an old program, so how you prepare, your events, to be kind of differentiator and attract more people except the son of Malta.
I think when it comes to organizing events, one of our biggest challenges is trying to make sure that it's not just any other conference in which we're here discussing stuff on stage, and possibly next year around December we'll meet again and discuss the same stuff over and over again, but rather to see how we can kind of squeeze whatever discussion points, whatever problems and challenges we came across with, so that anyone who's in the room wearing whatever hat he or she are wearing for their daily jobs, get to act on those problems, and hopefully next year they'll be the ones on stage discussing how they overcome the problems that they faced with and how to overcome the next couple of problems they're going to be facing with. Especially myself coming from a clinician background, I'd hate to think that I just stopped surgery and my clinical training just to become a simple conference organizer. It's not just about that. It's about nurturing an ecosystem, nurturing a community, and hosting an environment which makes people comfortable, not just to network on their own behalves, but rather to raise funding, expand their business opportunities, whatever they seek to. Comparing different conferences, I hate comparing different conferences. I could do at a conference once every week if it allows me to travel that much. So I believe every conference has its own kind of unique character around it, especially if they're in different locations. Obviously, London is very different from Malta. Malta is very different from Dubai. Dubai is very different from the US. So all of these different factors play around to give that conference a unique character, and hopefully you'll be able to meet different people from around the world. Another point I'd like to emphasize on, and something that I kind of found out a bit too late, is that when attending these conferences, the more work you do from before to prepare yourself, to be able to know who you're going to be meeting with, possibly scheduling in some meetings from before, which panels to go to, at the end of the day will help you make more good connections throughout the conference days. Sometimes at the beginning, I used to take these conferences for granted. It's like, well, I'll go there, I'll see who I'll meet, and I'll take it on from there. It doesn't, the best way is to kind of prepare yourself from before, go through the list of attendees, especially if there's networking apps, conference apps, so you at least can make a target list of people who you can meet, and then get to know the tips of tips of the trade, whatever they call them. So, for example, if you know that there's a big speaker, a huge profile speaking at a panel at that particular time, you know that he's going to be in that room around that time, and you're free to hopefully steal a couple of minutes from his or her time before or after the panel. So you'll eventually be able to learn these down the line.
Okay, yeah, sure.
One thing. Just to add to that point, now, one thing we always see in the MedTech conferences is the opportunity for the CEOs and the companies to present their case. Now, we don't do that in the medical conferences, surgical conferences. So we never had a Medtronic person or an Olympus person standing on the stage and telling us. It's always somebody else. Do you think there is something we need to change in the way, there is these conferences and there are medical conferences. So do you feel that it needs to come a bit more closer?
It does, but hopefully not to the extent that it's about people pitching their products and trying to get through the minds of surgeons, to eventually get through the minds of the clinical medical advisors to buy their products. So as long as, be it Medtronic or any of the other big guns, promoting their solutions, ideas, especially when it comes to conference, I think as a conference organizer perspective, you have a kind of sense of responsibility to whoever is attending, to make sure that whatever you're coming up with on stage is not purely trying to promote a pitch deck to sell one product over the other.
Because I think the reason I asked that question was then, so there are big companies who can go to these big conferences, but there are startups and people with great ideas are at a stage where they may not have the capital to do those things. So in transplant world, we had the first talk from a medtech expert about last year. That was the last year was the first time we had an expert, we had a speech by one person. And I remember thinking, my goodness, how far we are. And if you look at the general surgical conferences, we don't have a separate stream, even a session. So there's a lot of shift. We are trying to change the way. So therefore, that doesn't mean the ones with the big cash flow come in, present these things. We can give opportunity for even somebody with a startup or something where they have a product which they can showcase, just to get traction from clinical teams to do a validation. So I think that's where I think you're right. It's just that we can't let that be a commercial, where they sell the product. But at the same time, there is a balance in getting that through so that it's an opportunity for most of the companies, not the big ones, because that's where I think it's important. Yeah.
I agree, and I think we are in a move from, let's say, the old way of doing the things, like, exactly, just pitching a product, whatever. But I think today we have to talk more about an ecosystem. So like the surgeon, the doctors has to be in contact with the product guy and the product guy with the surgeon, but let's say in a fair relationship, not just selling, sorry to say that, selling bullshit, but really talking, understanding each other, and I think these worlds have to come together. And I agree with you, today we still have to be careful, because there is a risk that somebody is just pitching in front of you, and then they pay, the sponsorship, whatever, so they think they have the right to be in front and just pitch. But that's not what you want to hear. That's not what you want to hear. That's not what the audience want to hear.
And what healthcare needs neither.
Yeah, and that's even the next step. And then on that one, I like, I know Dylan very well. I cannot say we are friends because I'm older than you. I'm, my young brother, So, but, there's competition. The same happens in this conference world. There's competition, which I think should not be competition, should be collaboration. What is wrong? You see, Dylan is here, MedTech World, at the Giant event. Why Giant? They cannot go to the MedTech World and all that. So I think it's time that we come together and that we combine those resources, because those healthcare resources are scarce. We know it. So we should work together and come closer, share those experiences and work together. So maybe with that, I move to the next question. And whoever wants to start from both of you is, but what are we really going out of those events? What is happening after those events? Nice event, nice talk, nice products, nice learning, Are we going to implement it when we come out, or will we just wait for the next event and have the same nice time together at the event?
If I may, actually, going back to your previous point about competing between conferences, I don't want to speak more about conferences, because essentially that's not who you're presenting today. But going back to the health tech industry and medtech and digital health, I have sometimes even connected competing companies together, which might not be operating within the same region, and even if they were, there's no reason why not to, because I generally believe that when it comes to healthcare and there's companies working to solve similar problems, the more they get to work together, the quicker they're going to solve any challenges and get their devices or their solutions out there as soon as possible. And when it comes to the health tech industry and the healthcare industry, it's so big, so vast, be it Europe, UK, Middle East, North America, South America. So there's opportunity for all. So apologies for sidetracking back to the previous point, but when it comes to healthcare, can't have competing companies killing off each other, because essentially we're dealing with patients' lives, we're dealing with our healthcare practitioners' lives, and we should all be working together to make the most out of the resources we have.
Yeah, and I think with regards to the point of what happens after the conference, I think there's a lot of things to excite to. I would refer back to Shafi, what he did. He opened the door of the hospitals for the industry in a safest way. Because, I had conversation with some teams today, and there are some things we had a synergy in what we can do. These are new partnerships which I'm going to be forming with these teams. It just means that I think the clinical teams are happy to take that on. That doesn't mean we're going to be adopted. I think it's going to be an understanding of take the partnership to the next level, not to the completion. And I think that is the best part I find coming to these events. There's never a point where I walked away thinking empty or felt empty. There's always something. I think that is where the way these guys put together the conference means. It's in a framework where it is easy to interact with people. I like what Dylan said, it's the one-to-one meetings as well. And also it's us reaching out, because we are coming with a whole lot of problems. not personal problems, professional problems. But that just means that I went to one of the places, one of the exhibitors where I thought, that's interesting. So that just means that I think it really helps us to look for the solutions as well. We don't know understand the whole thing, but if there's a solution comes across which we can explore a little bit more in a way which is mutually beneficial, I think that's the best thing I get from these conferences coming in. Other thing is that really the message of what I was saying earlier, which is really go back and tell our team, hey, that's the one we went, apart from our social media posts. That's extremely powerful to tell our team. I mean, it was one patient who came last time. This time the patient couldn't come. She was feeling sorry for herself because she thought she was going to be missing the conference. That is the level of sort of engagement, what it helps. So therefore, I think there's a lot to take from a conference from this. One is the productivity for both parties involved, which is the clinical teams or other teams with the manufacturers, and the engagement part, which the organizers drive really well, as is we go back and tell our team as well. So it's something we recommend to our clinical teams to come in. And I think one of my colleagues here, he's actively championing this. They've got an organization which is looking at engaging with students. And I met a student who started a company with 600 students across UK involved in clinical informatics. That just means that we are, by doing all these things, we are future-proofing a healthcare system. Talking about NHS, I think that's what we are getting into. We are future-proofing it in a way that these organizations, these conferences helps to redesign in the way we think about healthcare. So therefore, there's a lot to take, personally, from my point of view.
Yeah, so thank you very much. And I think it's very important. I think we are, I'm not saying we are in a shift. It already started before. But we cannot work anymore with the old mindset. Like, I'm sorry to say that, but some hospitals are competing between themselves. I want to keep my patient and all that, but you might not have the same specialty and all that. So I think we are already starting to move that around, to work together, to help each other. I remember, 2 years ago when I was in Malta, I was saying, talking about, the intelligent hospital, saying basically, the hospital is on fire. We have to wake up. We cannot continue to play those games and just look how the fire is destroying the whole healthcare. So we have to come together, put it on the table, work together, And I think, let's say 2 years later, I have seen a lot of changes in that space.
Agreed. And I mean, going back to the conference point in terms of, so I've agreed with what you've said, but I think something that we need to see more is a patient's perspective when it comes to these events. And I personally found it very difficult to involve patients on stage because they're usually very shy. They wouldn't want to promote what they've been through. So if these healthcare conferences are to reach their full potential down the line, I think we should see more patients networking and integrating with healthcare practitioners, with startup founders, and with anyone else. Because essentially, I mean, if we're coming up with a digital health or a medtech device solution, anything else, we're affecting their lives, so we need to hear their feedback in one way or another, and not through any anonymous groups or other research which third-party companies can easily do, but hearing their conversation on a one-to-one basis in a comfortable environment, conferences or wherever else.
Yeah, and also it is timely as well. The patient expectations are changing. During COVID, we as a renal care team, we were doing a lot of remote consultations. These are patients who are, I'm sure people from UK, the app we all used. So we were using that. And post-COVID, 71% of our patients, the first question was, do I really need to come in? Because their care wasn't affected. They had a better experience. They're sitting in their own sofa. Then there was a study done in the Queen Mary. We looked at which are the patient groups where they will adopt this more. Because the common perception is patients who are older, they don't like to adopt these things. Patient who's not tech familiar. But actually, the patients who wanted to look at their medical records, who wanted to have remote consultation, are more than the 55, multi-organ dysfunction. So therefore, we realized that actually, the people who need this and want this more are the people whom we think they won't use it. And this is also from a part of London where the educational or social deprivation is very high. So that made us think that, okay, who gets more reassured by seeing the patient? Is it the patient or the clinical teams? So we are trying to find a balance here. So these kind of events, what it does is gives us the framework to say, there are certain things where you may not need to have one platform. It may be there's a combination of things you need to combine together. Like we have a prescription for a patient. There are a lot of different drugs. So I think we may need to think about having frameworks where a consultation is done more patient-centered and made easier for the patient, and preferably remote as well. But the biggest thing is that the shift is changing. Patients want those kind of care. Patient wants to consent, because when we did the clinical trials during COVID, we were doing remote consent, digital consent. So my current clinical trials, we have to make it part of it. It's not a mandated from NIHR. It's requested by the patients. So now we do digital consent for our clinical trials. So that just means that I think there is a big point of change in the way patients perceived technology into their healthcare. And it's really our responsibility to deliver it in a way where it is safer, transparent, and the process is transparent, and hopefully cost effective.
Yeah, I think you made a very important point from my point of view. I think before you also had the generation discussion. So younger generation, new technology, older generation, old technology. And that shifted with COVID, as you mentioned. And unfortunately, the more you get older, I know what to talk about, you get more requirements, for healthcare. But today, thanks to COVID, even the older generation get used, to do a remote consultation and all that, and then they can avoid, to travel, do as much as they can from home, only go physically to the place when you have to. And no secret, sorry for the doctors here, but no patient loves to go to the hospital, So there's even an anxiety, So whatever you can do outside of the hospitals to better prepare the patient to go to the hospital, we can do today. And again, I don't think it's a question of generation. I really think we not completely, but, we feel that gap. My mother-in-law, she even didn't use a cell phone before, but during COVID, she learned to do FaceTime to see her grandkids. So now these older generations also get to these technologies.
Agreed. No, very much so, actually. And even, coming from a small island like Malta, which everyone is very much connected, and we have quite an aging population, we got to witness this firsthand. Especially for a hospital that didn't have an electronic healthcare record back then. Patients couldn't access their blood results online. Now they've started to figure out how to actually browse the internet, go through the government's public healthcare dashboard, which is not the easiest to navigate, and getting to know about their blood results right after they're published.
Okay, anything else to add, or we open the questions to the audience? Because I think, we can talk for hours, but I think it's better to address some of your questions.
Great, thanks guys. Always good to see all of you together in one spot. Question for Raj and also Dylan around translation. Raj, you're an expert really to bring an idea from a company, small startup, to do a clinical trial, to raise maybe some money through various grants, etc., and then seeing it, doing the kind of validation model. So I'd love to get you to talk to the audience a bit about that experience, because you're specific, you're very good at that, right? And you're unique in that sense. Similar to you, Dylan, same question to you. What's the ecosystem like in Malta? Take an idea, and you've done a great job, by the way, in Malta to bring it really to the heart of innovation. Malta is the entry point into the EU, right, for a lot of people, right? So what are they doing? You've got a couple of universities, of course, you've got medical school, Barts is there in Gozo. How are you seeing that translation in the health sector in Malta? Is your medtech world having traction? Are you seeing some kind of purchase on the effort that you're putting in? So question for both of you.
Yeah, thanks, Shafiq. So I think it's such a key question, because when we started off with these kind of integration, I was doing basic science. When I left my training, I was doing basic science. I was sitting with rats, doing animal experiments and looking at the cells and feeding the cells more frequently than I helped my daughter, for example. But then when I started the medtech, I think what I realized was that the first thing is really to sit with the person who's coming with a solution to see what is that solution, and do I have a question first? Do I have a problem which helps the person? That's the first thing. And the second thing is really engage with them in a way which they understand. So none of the tech team who work with me, if they see a fistula, AV fistula procedure, I want them to see the procedure in the operating room. They said nobody I partnered with and do clinical trials or validation, any of those work, they have to see the procedure. So we get trust permission, we get the patient's permission. I want them there. And there are 2-3 products which we did where they walked away saying, Rajesh, no, we can do something better. So that's the first step, because then I understand where they're coming from. But more importantly, they develop the product and they see how the problem what we have, we demonstrate the problem, not just articulating the problem. Then the next step I do is we engage with our patient group before even we talk to our team, clinical team or the trust. So a lot of the clinical renal failure patients in UK, or even I would say most of the Western world, they have patient organizations. So my local organization, I reach out to them and say, hey, we've got this idea, what do you think? And they say, oh, I don't know. Or they will say, look, I like this. So because what that helps is that for me to know how big is the problem. We know from clinical evidence that it is a problem, but some of the solutions we are looking for is not even measured as a problem by healthcare teams. Like a lot of the patient-related experience measures, it's not even collected as a data. So therefore, I get that feedback from them. Then we do an internal peer review. So these are all happens before we tell the company or partner who want to partner with us saying, hey, we want to work with you. So therefore, all these things are bought in. And that timeline usually takes anywhere between 4 weeks to up to 12 weeks sometimes. But we give an answer to the companies who want to work with us saying that this is what we think it is, this is what the scale, what we think the problem is, this is what a protocol may look like if we need to do this take further on. Then of course it's easy for them to come and say, okay, can they offer the funding for us to work with them to get started? Or do we need to go for sponsored funding from recognized bodies or any other ways? So which means it's a very clear process. And I think, apart from maybe one where I had difficulty, most of the time this process seems to work well. And I think that's where I feel that a lot of times, and also the company is invested because they've seen the problem, not heard the problem. So yeah, that's the approach what I take, and it seems to work very well. Yeah, yeah. 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 Exactly. Yeah.
So when I came to start off the MedTech World Summit, actually 4 years ago, and started approaching different government entities, including Malta Enterprise, which is like the government's main arm to attract FDI into the island, they didn't even know what MedTech was, to be fair. I'm not sure how much you're quite aware in terms of Malta as an island. Up until a few years ago, we used to rely on tourism for our economy. Then different governments tried to inject different economies, from gaming, eventually AI, blockchain, plant medicine. And they've started getting to know more a bit about MedTech through my conference. And 4 years down the line, they're amongst our main supporters, be it financially, as well as with anything else. So when it comes to the actual MedTech industry in Malta, it's still very much in its infant stages, but the good thing is that in Malta, it's a small island, everyone knows each other, everyone is very well connected to the government. So when it comes to me or whoever else looping them in with international companies, be it MedTech or digital health, who would want to work to set up in Malta, not purely to increase their revenue, because with an island of around 600,000, I can't really say that a company is going to increase their business opportunities. But what Malta provides is a way to avoid taxes. Legally, jokes apart, we're actually always in fights with the European Union, because technically Malta, when it comes to international companies, they only pay 5% in taxes compared to my company owned by a Maltese, and I pay 35% tax. Technically, they're both charged at 35, but the government then gives a lot of tax rebates. So that's why one of the reasons why we're always fighting with the European Union. But taxes and financial stuff apart, the fact that Malta is a small island, one big main hospital, all the data centralized in that hospital, English is our official language, quite a good mix of people living from across the world. So it's not like you're going to test your solution to an island like Iceland, in which it's a bit more on their own. All of these provide a very unique basis for Malta to become a good test base for be it medical devices or digital health companies, to then eventually, after they get approved, EU certified and so on, eventually launch into be it the UK, be it mainland Europe, or even North America.
Any other question from the audience? You're still here, so use the time.
Thank you. My name is Mohammed. I'm actually a final year medical student. You touched on this before, but what are your thoughts on the importance of undergraduate students in making sure MedTech takes off? And how do you think we best go about that?
I'm speaking from my own personal experience, as in throughout my medical school, which is considered, in all fairness, I mean, the Maltese education system, it's one of the best exports we have. And even when it comes to our medical school, most of us come to the UK to specialize, to finish our specialization training. Anyways, but when it comes to the medical school, we never had actually, and I've graduated in 2017, so I mean, it's quite recent. We never had any teachings about digital health, about medical devices, and so on. I purely took it upon myself because I always was involved in entrepreneurship. It was quite natural for me to go down this route, and obviously associated with healthcare because I spent most of my life. But speaking to colleagues of mine who up until today I'm still finding it difficult to convince them to come to a MedTech conference held in Malta, I mean, it's quite a bit, because essentially when it comes to, for us to completely change healthcare, there needs to be an entrepreneurial approach, and this entrepreneurial approach can only come from the medical doctors, from the healthcare practitioners who are already working within our hospitals. And if we were to inject some fresh energy into the whole digital health and health tech ecosystem, it needs to come from the brains that are graduating right now. Having Queen Mary at our conference actually last October was quite refreshing, knowing that there's a medical school fully supporting a MedTech conference in Malta and so on. So I mean, the future does look bright.
Yeah, and I think firstly I will congratulate you for being here, as any other students here or on the conference, because this is what needs to be done. And we are slow. When I say we are talking about top-down in organizations. Not just in UK, Europe as well. US has taken a bit more a different tack on it maybe 2 decades ago. Stanford and Harvard, they have a much more established process to guide students such as you doing these things or getting tapped into this process. But I think what has changed is like what Dylan said, it's really the engagement is getting better. We, Queen Mary, for example, other universities are looking at having a curriculum built into your medical course, or nursing as well. We're not just looking at medical, nursing as well, to see whether it can give them a taster. And also for people who are not medics or nurses here, you have, when you're graduating, during your course, you get time off to do projects. You get 3 weeks projects, you can do, a lot of time they will do clinical attachments to get more experience. Now we're integrating technology as part of it. So people can go and do committed time, SSCs, which student selected component, they can go and work in a medical technology company to get a taster for it. Are we matured enough to take an idea from a student, to take it, support them, mentor them to a product of point at where they can be commercializing? We are not there. Maybe US is there. So in BOTS, for example, in Queen Mary, Shafi started BOTS-X, which is a program, and I think that's a successful one. But that is one of the few, handful in the whole UK. So therefore, certainly we are slow, but we definitely recognize that. There are lots of things are being done. And also in UK, the General Medical Council, which is the body registers us to practice, they are at the moment looking at how we can integrate that in a part of your training. So therefore, as a part of your F1, F2 training, they are really thinking about, can that be a component? So there's a lot of things are coming together. Unfortunately, we are slow in getting to this moment, joining in this train, which we have to. But I'm glad that it is driven by you. And the last thing I would say is that students are now asking for it. So if the universities are not ready for it, hospitals doesn't have programs for this, they may not come and work with you. So which means even in UK, which is a government employed system, people will say, I won't choose the rotation. They will choose to go for it. So which means if you, for example, when you graduate, you may have options to have this part of your rotation in one region than another region. So that is going to be a problem. So there's certainly slow start, but definitely we're getting there.
Yeah, I fully agree with that, and sharing some of my experience going, worldwide to conferences. So I think it's a very good question. It's very important. It's coming from you, like the discussion, about the impact, the clean method and all that is driven by the younger generation. That's the same. And I don't want to talk too much again about Malta, but 2 years ago when I went to Malta to the conference, I was contacted by the German student, not a medtech student, but he wanted to talk with me. And you know what this German student was doing in Malta 2 years ago? A master of blockchain. Where do we have a master in blockchain in the other European countries? So Malta, still from the size and, let's say, to differentiate themselves, is quicker in doing such decisions. So things are coming, like you say, but we are still too slow. In September, I was at the World Pharmacy Congress in Australia. And I was, after my speech, I was on a panel with two professors from the University of Brisbane. And of course, in the audience, there were many students. And I talk about the metaverse, pharmacy in the metaverse. So those students ask, how can we get some hands-on? How can you get that in our curriculum? And even the professor say, yes, Philip, who can help us? So I think they are more open now to do this kind of stuff. And it's coming from you. It's coming from your generation.
Yeah.
So I'll tell you what, so I'll just answer that question a little bit. So one of the things we did in 2016 is introduce Bart's X course, innovation, entrepreneurship, digital health, into the curriculum, but for the entire year 3 cohort. And so that took a lot of push. The problem with medical schools is that they're not fit for purpose. They're not relevant for 2023. They're old-fashioned, and they're about 100 years old, almost. The problem you have is everyone fighting for space, anatomy, physiology, biochemistry, all fighting for their specialty. Not saying actually what creates a better doctor in the future, what do we need to bring into the curriculum and take things out. That's the problem you have. Everyone's fighting for space. So the way I brought it into the course, I took some surgery away. I was head of surgery. They said, we need some weeks. I said, I want to do Bart's X course. You've got to find space. You know what? We had 12 weeks of surgery. I can do it in 10. I'll take 2 weeks and bring innovation in. And that's how I did it. But you have to be pushing. And I was surprised in 9 years, we're still the only medical school in the country running these courses. So, Dylan, the problem you have is the barrier. We know it's required. We know we need to create a cadre of doctors, but yet medical schools are old and fashioned and traditional, and they don't want to change. At some point, they're going to have to, and the pressure will be from students, saying, we demand change. The new generation, Gen Z, right? We want to be doctors. Others will leave the profession, and they are leaving to go into medtech innovation. So we have that dichotomy. We know there's change happening. We know what to do. The system is so old-fashioned and stuck that it's not allowing to change. So I just thought I'd add that conversation piece.
Absolutely. And also, you'll be facing a patient who's got an app telling you what the blood pressure readings are. They're going to be telling you, this is the number of steps I walked. This is how much calories I took. They may even have a blood test in it. So therefore, I think you're absolutely right. And I think one other thing I noticed was the funding. I think that is where I think the organizations, the educational bodies need to come together and decide. Because one of the big problems is our trainees wants to do them, but there's no money for them to do it. So I think that is where I think there has to be a guidance from the GMC and other registering bodies so that the students can say, okay, I'll do the surgical course, I want to become a surgeon. And also, you know what? I like to be like Dylan. I want to try the medtech, not to take the medtech. I mean, these are the guys who took it on, jumped in, and done really well. But that's the biggest step to take sideways from a medical career, which gives you quite a safe job. So certainly, I think, these are the things we need to, not me or not Shafi, but we need to guide the organizations with the pressure of you guys, students, to make that change. Yeah.
So maybe just to add another point on that, I was recently at a panel discussion in Switzerland, with 3 representatives of hospitals. And again, there's another thing, private hospital, public hospital. So one of the private hospitals from Geneva, they have a chief innovation officer in the hospital. Where else do we have? I think there are some, but just to say, that's becoming a key position. And of course, you have also to, as I said, it's a private hospital. You can have the money, afford and all that. But I think it's important that things like that start to come. A chief innovation officer at the hospital. So startups can go to him, can pitch to him, and then he might bring him to the private clinic.
And I would say that, Sobat, my colleague who's here, so he's part of the National Clinical Informatics Group. So which means really our innovation team, chief technology officer in the hospital, they should be offering work placements. So we are talking about it. So work placement with surgery, medicine, why not the tech department in the hospital? So we're having conversation about can we offer our students SSC 2 weeks, like what Shafi says. So you get a low risk, try it out in your 3rd year. That's not for me. That's okay. But you tested it out, so you're not unhappy. Yeah, I think there's a lot of streams needs to come together, and it is happening. So that's the only thing I can assure you, that it is happening.
Any other questions? So we're on time. Thank you, Chef. Thank you.
Thank you.
Thank you. Always a pleasure. Thank you, Dylan, for coming. So Dylan's come a long way from Malta to spend time with us, and we're really grateful, Dylan, for taking time out of your busy schedule. Raj, as always, and Philip's always a great supporter of Giant. So look, I mean, it's been a great 2 days. As I said before, this has been the biggest MedTech event in the UK ever. We had over 3,500 people registered. I think probably about 2,500 have turned up in the last 2 days. Everything's been packed. Hopefully you've enjoyed it, the experience from us. Hopefully you go away with a few points for learning. What we want to do is just create an experience, a community. That's all we're after, to kind of light the fire of innovation, understand it better, and have the network that you need. Hopefully we'll have a chance to speak to the startups, the people that might support you on the journey. You might trigger some thoughts about how you might innovate yourself. And by all means, connect with us on social media platforms, on LinkedIn or whatever. Share your stories on Giant and work with us to build that community as we go forward. So thank you very much for turning up. Thanks to Steve at the back. Steve, round of applause for Steve, please. Our AV mics. And Steve was perfect. We had no glitches whatsoever in the whole 2 days. It's all managed perfectly, all worked really well. Thank you much. Yeah, no, I came in and out. And of course, the biggest thanks is to our conference makers. What we realized early on is that we had this amazing talent pool that very few people would use. These are our medical students. They support us. For example, at the back. They come for their 3rd, 4th, 5th year medical students from all around the country. They want to be involved. They have no access. They become our interns. They work with us to design the program, design agenda, make phone calls, wait outside here. And you've seen the last 2 days. Many of them have just experienced, they've come along, helped us do anything. They're so humble. They'll go and get the food for you. They'll go and clean up on the back end. Honestly, with that, and you've not seen what they do in the back end to make your lives easier. It's the only conference I've seen in the UK that gives free food and drink for everybody, whether you pay for a ticket or not. It doesn't exist. The coffee isn't so good, I hear. But if you want it, you go and pay for it. We're here. Nothing comes for free in life, right? You got tea and coffee and everything else, right? Well, if people were complaining, I said, you know what? There's a shop out there. Go and get it like every other conference, right? But we've spent a lot of money. We could take the money and say, you know what? Let's take the money, not pay for your food. But we want to invest in you guys. Enjoy your time, not go outside, spend as much time as possible. And Barry and I felt very strongly that you should have the experience, not worry about things like food, drink, etc. in this context. So hopefully give us feedback from the conference, good and bad. We want to hear what worked well. We'd like to hear about things we've done okay, but also more about critiquing about what could be improved. We're all in this. We listen every year. We go back in the next 3 months. We review what's going on, get the feedback, and we plan on the next version in December 2024. But your feedback is crucial to us. Yeah, we really want to make sure the experience is better. Yes, this room, I've decided we should extend next door. I've taken that on board already. It was tiny. People were queuing out. Apologies for that. But they told us that room was already hired out. But I went to the next 2 rooms. They're empty. So actually, we'll open it up to 2 more rooms, make it much bigger for people. So I've taken that on board already. So happy to learn from things. Any last points to make? Anybody? Any issues that you've had? No? Good. Go and enjoy. Is it 5 o'clock? It's 5 o'clock. Thank you. And you're still here, 5 o'clock on day 2. Thank you. Oh, and now before I go, when's the date for Malta? Hold on a second. Malta?
6th to 8th November of next year.
Okay, so in your diary, go to Malta, come to MedTech World. It's beautiful, isn't it?
Yep.
Yeah, sorry. Yeah, great. Thanks.